What happens during the second trimester of pregnancy? This is an exciting time for many expectant moms. As you move from week 13 to 28, you'll likely notice some big changes. The morning sickness and exhaustion of the first trimester might be fading, and you may start to feel your baby move for the first time. Your baby bump will become more noticeable, and there's a lot more happening behind the scenes as your baby grows rapidly. This period is often the most comfortable part of pregnancy, so it's a great time to prepare for your little one's arrival. Let's explore what you can expect during these important weeks. Changes in your body during the second trimester. Wondering what's happening to your body in the second trimester. This stage of pregnancy brings about many changes, some expected and some that might catch you by surprise. Let's talk about what's going on and how you can manage these new developments. Itchiness in your lower abdomen. One thing you might notice is some cramping or aches in your lower belly. This happens because your uterus is expanding, which puts pressure on the muscles and ligaments nearby. The round ligament muscle, in particular, can cause a dull ache or even sharp pains as it stretches. Minor cramps are normal and can be triggered by things like gas, constipation, or even sex. If you're feeling uncomfortable, try soaking in a warm bath, doing some gentle relaxation exercises, or shifting your body's position. A hot water bottle wrapped in a towel pressed against your lower belly can also bring some relief. Backache. As your baby grows, you're gaining extra weight, and this can start to take a toll on your back. Itchiness and soreness in your back are common, but there are things you can do to help. Make sure to sit up straight and use a chair that offers good support for your back. When sleeping, lie on your side with a pillow tucked between your legs to ease the pressure. Avoid heavy lifting and choose low-heeled shoes with good arch support. If your back is really bothering you, ask your partner for a massage or treat yourself to a pregnancy massage for some extra comfort. Bleeding gums. Another change you might notice is bleeding gums. About half of pregnant women experience swollen, tender gums, which are more sensitive and prone to bleeding. This happens because hormonal changes are sending more blood to your gums. Your gums should return to normal after your baby is born, but in the meantime, switch to a softer toothbrush and be gentle when flossing. Don't skip on dental care, though. Studies show that gum disease during pregnancy can increase the risk of premature labor and low birth weight babies. Braxton Hicks contractions. You may also start to feel your uterus tightening now and then, a sensation known as Braxton Hicks contractions. These are normal and not a sign of labor, just your body's way of practicing for the real thing. Braxton Hicks contractions usually cause discomfort rather than pain and can be triggered by things like exercise, sex, dehydration, or even just someone touching your baby bump. To help yourself relax, try taking a warm bath, sipping on some herbal tea, or changing your position. Breast enlargement. Your breasts are also continuing to change. The tenderness you felt in the first trimester might be easing up, but your breasts are still growing in preparation for breastfeeding. You might need to go up a bra size or two, so look for a supportive bra that helps you feel more comfortable. Congestion and nosebleeds. If you're dealing with a stuffy nose or even nosebleeds, you're not alone. Hormonal changes during pregnancy cause the mucous membranes in your nose to swell, which can lead to congestion and even make you snore at night. These changes can also make your nose bleed more easily. Before reaching for a decongestant, check with your doctor. Saline drops and other natural remedies are often safer options during pregnancy. You might also want to use a humidifier to keep the air moist. Dizziness. Feeling a bit dizzy at times. As your uterus expands, it can press against blood vessels and cause dizziness. Low blood sugar and hormonal shifts can also play a role. To manage dizziness, try to avoid standing for long periods and rise slowly from sitting or lying down. Regular meals, plenty of fluids, and loose, comfortable clothing can also help. Skin changes. Finally, you might notice some changes to your skin. Many pregnant women get that famous pregnancy glow, but hormone changes can also lead to brown spots on your face or a dark line down your belly. These changes should fade after your baby is born, but until then, make sure to use sunscreen when you're outside and consider wearing a hat for extra protection. You might also see stretch marks as your belly grows. While there's no magic cure for stretch marks, keeping your skin moisturized can reduce itchiness and make you more comfortable. These are just some of the changes you might experience during the second trimester. It's a time of rapid growth for your baby and lots of changes for your body. Knowing what to expect can help you feel more prepared and comfortable as you move through this exciting stage of pregnancy. Emergency symptoms. When to call your doctor. It's important to know when something might be wrong during your pregnancy. If you notice any of the following symptoms, don't wait until your next prenatal visit. Call your doctor immediately to make sure everything is okay. Severe abdominal pain or cramping. Experiencing intense pain or cramping in your abdomen is not something to ignore. While some mild cramping can be normal, severe pain could be a sign that something is wrong. Bleeding. Any kind of bleeding during pregnancy should be checked out right away. Whether it's light spotting or heavier bleeding, it's important to let your doctor know. Severe dizziness. Feeling dizzy can be common in pregnancy, but if it becomes severe, it could signal a problem. Don't hesitate to call your doctor if you feel lightheaded or like you might faint. Rapid or too little weight gain. Gaining too much weight too quickly or not enough by 20 weeks could indicate an issue. Your doctor can help you understand what's happening and make sure you and your baby are healthy. Other concerning symptoms. Other signs like jaundice, vomiting, or excessive sweating are also worth a call to your doctor. These symptoms might seem unrelated, but they can be important indicators of something that needs attention. If you're unsure about any symptom, it's always better to check in with your healthcare provider. Your health and your baby's well-being are the top priorities. Baby's growth in the second trimester. Curious about what's happening with your baby during the second trimester? This is an exciting time when your little one is growing rapidly and becoming more developed each day. Physical growth. By the end of the second trimester, your baby may weigh up to 3 pounds and measure up to 16 inches long. Their brain and other organs are making huge strides in development, and their heart is pumping about 100 pints of blood daily. Although their lungs are fully formed, they're still getting ready to take that first breath. Movements and senses. Your baby is also becoming more active. They can kick, turn, and even respond to your voice. Their eyes and ears are now in the right positions on their head, and they can open and close their eyelids. As they sleep and wake in cycles, they're also growing eyelashes, eyebrows, fingernails, and toenails. Hair and skin. During this time, hair begins to grow on your baby's head. They also develop a fine layer of downy hair called lanugo, which helps protect their skin. Their body is covered in a creamy white substance called vernix caseosa, which keeps their skin safe and will be absorbed as they grow. In these weeks, your baby is getting ready for the big day, and their development is truly remarkable. Second trimester tips for twins. Expecting twins? That's double the joy and double the planning. Here are some practical tips to help you along the way. Choose a doctor. Start by talking to your OB about whether you should see a maternal fetal medicine specialist. This type of doctor is an expert in high-risk pregnancies and can provide extra care when you're carrying twins. Take naps without guilt. Feeling extra tired? Don't hesitate to take a nap when you need one. Carrying twins means your body is working harder, even when you're resting. Focus on nutrition. Make sure you're getting enough omega-3s, which are crucial for your baby's development. Fish like salmon and sardines are great sources. Also, check with your doctor to see if your prenatal vitamin covers all your nutritional needs since you're eating for 3. Be smart about baby gear. Before buying 2 of everything, see what your baby's actually like. Some gadgets might not be necessary, and your twins might even prefer sleeping together in one crib at first. Plan ahead. Think about your exercise routine and ask your doctor if any adjustments are needed after 20 weeks. Also, consider looking into a breast pump, especially if your twins might spend time in the NICU. And don't forget to start searching for childcare early, as finding 2 spots can take time. Expecting twins can be a bit more challenging, but with the right preparation, you'll be ready to welcome your little ones into the world. We hope these tips and insights help you navigate the exciting journey of your second trimester, especially if you're expecting twins. For more useful information and support, be sure to hit that subscribe button and give us a thumbs up. If you have any questions or need more tips, drop them in the comments below. Stay tuned for more updates and helpful content to guide you through every step of your pregnancy. Thanks for watching.